Andrew Holman. I'm a in the trenches rheumatologist from Seattle, and spent a lot of time with autoimmune diseases, and particularly fibromyalgia. Had an exit in 2007 discovering how dopamine affected fibromyalgia, which is a very important topic. Taught me about the autonomic nervous system and stress responses. I actually retired at 46, but I came back 10 years ago to bring Inmedix to patients because we had a diagnostic opportunity that was used in professional sports to win literally Super Bowls, World Cups, gold medals. And we had done clinical trials demonstrating how well it worked as a very simple and scalable, non-invasive clinical biomarker for stress. I was taught, as all rheumatologists and doctors were taught, that the immune system was firewalled against other outside influences. You wouldn't want it to suddenly break down and all of a sudden you die of a innocuous bacteria like HIV, does to you as an illness. It turns out it's completely the opposite. The brain monitors by milliseconds your inflammation, and it plays a pivotal role in turning it off.
Mm.
You can turn it on with burns, infections, trauma, but no one ever understood how to turn it off. And that came from Kevin Tracy at Feinstein Institute in New York, looking at the vagus nerve. So you hear a lot about the vagus these days. Well, fortunately, a digital integration is very simple. There's no transport, there's no blood draw, there's nothing. You just hook up the wires and you get your test results in 5 minutes. You can do this anywhere as long as there's Wi-Fi and electrical power. It runs on a battery. It's all about understanding what matters, and health systems need to know what matters so that we can address when it's gone wrong to reduce the cost of care and get those better outcomes. So we did our clinical trials 8 years before we raised a penny to bring this to market. We want to make sure it really worked and predicted a year in advance who would respond to treatment of rheumatoid arthritis, and then participate with other people to triple the rate of remission. What a diagnostic does is it opens an entire new field of medicine. When the blood pressure cuff was identified, now we understand why people in their 50s die suddenly of kidney disease, why
Mm.
people get accelerated heart disease and stroke. So now we measure it like a vital sign. We do something about it to prolong people's lives and health, right? Autonomic nervous system is the same story. We all know stress matters. You don't have to convince anybody. But if you can objectively measure it with individual clinical precision, now you get the excitement of the patients to say, what can I do to help myself? And the doctor saying, what can I come up with? Even if some of it's not on label, we have licenses that we actually are allowed to practice medicine.